or to be able to raise awareness. Now, I'm going to switch off my video for just a minute because I'll be multitasking. So excuse me for that. So, all right. So when we talk about stigma, what the definition of stigma in the world of mental health would be viewed as is stigma is basically when someone views you in a negative way because you have a distinguishing characteristic, in this case mental illness, or a personal trait that is thought to be or is actually a disadvantage or a negative stereotype. For example, when you think about when you were growing up, what terms of reference were used for people, or even not even when you're growing up, even right now, when you're dealing with even a friend and they seem to have lost their mind, or some of you are dating, so you have a girlfriend and she's having a moment of rage or she's ranting. All of us are very quick to label that and say, I'm a cheesy. You know, we don't even package it in a way that is palatable. We say they've gone cray-cray, you know, they've gone mad, they've lost it. Have you, you know, if right now you have a friend you are in campus with, or someone you schooled with in high school, and something happened and they suffered a mental breakdown, if you encounter a friend and you ask, how is Njoro? Very quickly you'll be told, you haven't had, that guy. You know, we always used to see it. He lost it. Zake ziliwachana. I don't know if everybody understands the local language, but zake ziliachana, you know, Anat is loose. You know, we even talk about it when it comes to our lecturers. There's a loose nut. Now, all of those things may be classified as stigma. Now, the thing about stigma, it is not only applying to issues of mental health. Currently, with the COVID-19 situation, we have seen people suffering from stigma or people being stigmatized as a result of what it is that they are going through, or the fact that they happened to get infected, you know, with COVID-19. And hence you're seeing a lot of people are not coming outright and saying, this is what's happening to me. And even when it has happened, for example, this particular week, we had someone who is a social media influencer coming out and saying, okay, guys, take care of yourselves because this is actually happening to me. This is what I am going through. What did Kenyans do? Kenyans decided that a person cannot be on oxygen when they're in their home clad. They decided a person, if you're having trouble breathing, you should not be able to talk. We collectively as Kenyans, with the larger population rather, or Kenyans on Twitter, we decided that this gentleman was not sick. We decided that he was doing it for show. And very quickly we went ahead and instigated a challenge using his name. Now that in itself is stigma, and that would cause someone not to come out right and say, this is what I'm facing and I'm going through this problem, because clearly it will lead to discrimination. When you talk about discrimination, it can be very obvious, like what we did to that particular gentleman, or it can indirect, yeah, or it can also be unintentional or very subtle. I'll give you an example. For a lot of people, when you meet someone who is crazy, like we would put it in professionally, I would say someone who has suffered a mental breakdown, someone who's having an episode of psychosis. If you encounter that person, your default setting as a layman will be to run away, to distance yourself from that person. Because remember, a lot of these people, sometimes they will forget to look after their personal hygiene. Sometimes, so they will be looking all sorts of ways. So my reaction as a psychologist perhaps would be to interact with them and to want to get to know what it is that they are going through. Maybe you can say, because ethically I am bound to provide unconditional positive regard. I am bound by my ethics to accept people for who they are, not how they seem or what they appear to be. So sometimes stigma can be very direct and straightforward, such as someone saying, wewe mwenda wazimu toka hapa, wewe unajua unatupanga mbao. That is very straightforward discrimination or stigmatization. But when it's subtle, and that's what a lot of us have. We have subtle and unintentional bias. We have subtle and unintentional discrimination. You do not want to be associated with that relative that is, you know, that whose head, as the village would say, is not correct. I don't know how many of us would be comfortable with identifying with the village madman. And I'll tell you for free, in our village where I come from, the person, that person, you know, think about your village, your estate, you know, that crazy person, the one who collects papers and the like. Now that person in our village, that person happens to be my uncle. And we're not talking about my uncle 12 times removed or CG looking at it from which angle. We are actually talking about my uncle, like first cousins with my mom. So when he sees me, he comes to the car. So I may not have an option, you know, and I also have the option of not telling you guys that this is the person that I am related to. You get? But his family, he's my family. So are you able to identify with that person? Are you able to speak up in this forum and say, okay, guys, last year I suffered a mental breakdown, maybe because of the stress that I was going through, or guys, today I'm feeling really, really dark. I really feel like life is not worth living. Would you be able to tell your friends that and have them actually take you seriously and have people not walk on eggshells around you? Because walking on eggshells around people that are suffering from mental issues is also a form of stigmatization. Now, it would be very important to know that it's possible for you to self-stigmatize. While we talk about stigma and it looks like it's something we do to other people, it's also something that we are very capable and very able to do to ourselves. So it's possible for you to look at yourself and not want to deal. Earlier on today, I was talking to young adults about emotional intelligence, and I was telling them that the hardest thing for people to do is to quiet the distractions around them, quiet the social media, quiet the TV, you know, get off of Facebook, Twitter, and Instagram, and actually have a moment where you're sitting down and you're thinking about your life. Now, when you do sit and think about your life, when you think about that moment when those results came back and you had not done as well as you wanted to do, and you felt that life was not worth living, when you look back right now, what is the feeling that comes? Is it a feeling of shame, or is it a feeling of triumph that I actually went through that and I came out of it? That in itself can be able to tell you whether you have been a victim of self-stigmatization. Now, from a psychology perspective, what is stigma? Stigma is a powerful social process of devaluing people or groups based on real or perceived differences such as gender, age, sexual orientation, behavior, ethnicity, or in this case, when we're talking about it, wellness or health on different parameters. When we talk about discrimination, discrimination is what comes after stigma, and that is the unfair and unjust treatment of an individual based on socially identified statuses. Now, it's important for me to clarify that there is hope. There is hope. There is hope. When you're talking about depression, when you're talking about all of these other mental illnesses, there is actually hope. It is not a hopeless situation. And maybe when we understand that it is not a hopeless situation, then we will be able to understand that that we will be able to reduce the stigma that we pour on these people, or even pour on ourselves. As we do this, and as we're talking about depression and other mental conditions, maybe in the stigma related, it's important for us to be introspective, so that you're not just looking at what I'm sharing with regards to, oh, I haven't been doing that to other people, or I haven't been with someone who has gone through that, but also be introspective and look at, have you as a person, as an individual, faced any of these challenges? And if you have, or you have someone in your family or in your circle that has, please understand that there is hope. The opportunity to get help for mental health can greatly improve a patient's quality of life, and even that in the worst moments of his or her battles with her condition, it is not permanent. We tell people this, that the company where I work from, we have psychiatrists, and what the psychiatrists do is, one, they diagnose the problem. Number one, they diagnose the problem. And then number two, once they have a diagnosis, whether it is depression, schizophrenia, bipolar, anxiety disorder, once they have been able to identify this particular problem, they move on to the next level, which becomes prescription. They prescribe medication, and the phase of prescriptions might take a while in terms of adjusting medications, because people react differently to medications, and so that the prescription that fits one person will not cut across an entire group of 20 people suffering from the same issue. And so there is an adjustment period where between the doctor and the patient, they are able to talk, and the patient might say, the medication you gave me is making me very sleepy, and so I cannot function during the day, in which case the doctor will go back and adjust and maybe say that particular medication, if it's being taken once a day, ensure that you take it at night. That way, even if it invokes drowsiness in you, you're already done with your work for that day, and so you can just retire to bed. Someone else will say, this medication is causing me to feel nausea or is messing with my appetite, and the doctor is able to adjust the dosage or even the medication accordingly. Once they are past that area of prescription, we move on to the next area, which even as for psychologists, we will step in, and this is the area of management. Then we are able now to do a follow-up, because for some of the cases, they will be on medication for a long time. For some of the depression cases, they will be on medication for a long time, depending. When you're looking at depression, I'm sure you looked at, there are people who get into maybe postpartum depression, which is the depression that will come in after a mother has given birth to a child. Now, the way that is treated may not be treated the same way as someone who has had depression, maybe based on the stresses of day-to-day living. That may be treated. The period of time that that person is on medication may differ. However, the point is, this situation is not permanent. If the patient continues to take their medication, then they continue to have a life that is free of symptoms. Remember, what we are addressing at that point is the symptoms. How has the depression presented itself? How has the condition presented itself? Majority of the clients are basically able to live majorly without any issues that would impede their day-to-day living. The symptoms will come and go. Yeah, so the symptoms, so for people that have gone through depression, they will tell you, they can tell when they're about to get into a dark space. They can tell. For those that I have not gone through depression directly, but I have fought my, small battles, maybe with issues such as self-esteem, and it triggers those dark moments. And over time, because of self-awareness, which is what at management level we would be working with the client to have more of self-awareness, so that they're able to perceive that, the way I'm feeling right now, I am about to slide into my dark seasons. Better yet, they are able to recognize what we call triggers. They are able to identify that whenever, like for example, a teenager will tell you, whenever I interact with my mother or I interact with auntie so-and-so, then it triggers. I end up going back to that dark space where I don't feel like life is worth living. So they're able to identify the triggers. All said and done, the symptoms come and go. They do not last forever. So it's not a depressed state like today, tomorrow, the day after. Symptoms come and go. And so we manage that. And with treatment, all mental health conditions will continue to improve as long as the client adheres to their medication. That said,
Hello.
stigma.
Hello.
Hi, are we okay?
Hello,
All right.
Wanjiku.
Yes?
You were breaking, you were lost for a moment there.
Oh,
Didn't hear
okay.
you.
Can you hear me now?
Yes.
All right, so I'm saying, all said and done, the symptoms do not last forever. And as long as the client adheres to their medication, then the symptoms will be able to live a symptom-free life, and life does get better. So that is the hope for maybe anybody who has gone through the journey of depression, or has a loved one that has gone through the journey. Now, that said, stigma can have some very, very harmful effects. The stigma that we met out to others and even to ourselves. And some of those effects can be reluctance of some of our clients to seek help or to seek treatment. You can have, and let me also talk about another form of stigma, even as I talk about the harmful effect. There is the stigma that we put on people when they say that they are going to see a therapist. When a friend says, I think I need to see a counselor, and then someone asks, kwani unasikia ni kama una kreki? You feel as though you're losing it. Ama, why do you want to go see a therapist? You know, and people will put you to task to defend the reason why you want to go see a therapist. I want to implore you that it's not only people who have mental issues that will come in for a session. It's not only someone who has depression who will feel the need to go and have a counseling session. As a matter of fact, if we would encourage people to seek assistance, to talk to someone, we might actually be able to get to keep a number of our loved ones from actually getting to that point where they are being diagnosed as having depression. We might be able to help people manage stress better and therefore be able to keep them from actually getting to that point where, quote unquote, they snap. So one of the effects of stigma, and that would be, for me, that's the major one, would be when we stigmatize people, we create a reluctance, not just in them, but even in society, for people to seek help or to seek treatment. Another effect of stigma is the lack of understanding by family, friends, co-workers, and the others. When there is stigma involved, obviously there is no understanding. Nobody has time to want to know why ABCD is happening the way it's happening. That is, it's not a factor right now. All that matters right now is so and so lost it, bottom line. As to the reasons why, it doesn't matter. I want to ask you guys to go back to a few weeks ago, and we had a lady from, I believe that was Naivasha, who actually murdered her 4 children. And people are very quick to spiritualize or to look for multiple explanations. It seemed like mental health was a last resort in explaining why this lady did what she did. It's like mental health is what we land on when there is no other explanation for why people have done what they have done. That shows you that there is lack of understanding because of the stigma that we have attached to this. Again, there are very few opportunities for work, for school, for social activities, and sometimes even trouble finding housing. I wonder, for some of us, someone said that they are on parenting duty. I am also a mother. You guys, for those that do not have families yet, some of you are intending to have families. The question is, how comfortable would you be to employ a house manager who has had a mental breakdown before? Would you be comfortable? For those that are in workplaces, how comfortable would you be if there was a disclosure that person so-and-so, or, colleague so-and-so was once admitted to Mathare in the psych ward? How would you respond to that person? Wouldn't that be the explanation that all of you jump to when that person does something something out of the ordinary in the office? People would very quickly go back to, wachaneni na yes, you guys know this person has even spent a month in the mental facility. So don't judge that person. Again, there is bullying, there is physical violence, there is harassment that comes as a result of the stigma that we attach. Excuse me. if the village crazy, your village madman or woman, quote unquote, comes close to you and makes a move as though they are going to touch you, what will your reaction be? What will your reaction be? What sort of words will come out of your mouth? And I'm just sharing that to have you, so that you don't think that stigma is very far from us. You don't think that stigma is what your neighbor does or what that relative does. You're able to personalize it. So think, if right now a madman came and he told you, and please note, I'm using quote unquote madman, someone with a mental disorder, whichever form, comes to you and says, sister or brother, ninunulie chai, will you be comfortable to get into a restaurant and sit with people? Now, amazing. I'm seeing Nancy has come in, so I'll just finish with that slide and then allow her to continue. The other thing is, health insurance doesn't adequately cover your mental illness treatment. Again, that's a form of stigma from people in one, it's like from one industry to another industry. So health insurance may not cover all the things that you will need to provide for someone who is going through a difficulty brought about by mental illness. And the last thing is the belief that you cannot succeed at a certain challenge and that you cannot improve your situation. Again, remember we said stigma. There is stigma to others, and then there is self-stigmatization or the discrimination against yourself. So it's very possible because you have, in the past, you have been depressed. In the past, you have not maybe handled stress in the way you believe it should be handled, or you have not, or even for some of us, it's just because we do not fit in a particular mold. Because we don't fit in a mold, then you'll be able, one might look at themselves and say, okay, because I suffered depression in Form 3, I cannot get an A like the others, or I cannot get a first class honors, I cannot graduate cum laude because I went through ABCD when I was in my second year. I suffered a breakdown or I had depression. All those things are difficulties or situations that may be worsened by the presence of stigma in our lives. Kevin, I want to hand over to you so that you can be able to bring in Nancy. As I said, I was holding the fort for Nancy, and I have seen David acknowledging her that she's in the meeting so that she can be able to continue from where I have left off. It's been a pleasure. I will remain in the meeting to hear what Nancy has to say as well. So thank you guys, and yeah, have a lovely rest of the meeting.
Thank you very much, Wanjiku. That was a nice presentation. Though we didn't see the slides, if it's possible, you can send them to us.
I'm sure Nancy will share the slides. It's only that it's her presentation, so I was only holding fort for her. So when she takes over, I'm sure she will advise you guys on the slides.
Okay.
All right.
Yes, we have learned something. So if since we don't have, time is not on our side, I would like to invite Nancy. Nancy?
Very sorry that I've come in late. Is it okay, Kevin, you allow me to share my screen?
Yes, you can share your screen.
Yeah, I don't know which slide Tina had reached, but
she was on stigmatization.
Yeah, because the whole topic is about mental health and the stigma. Are you able to see it?
Not yet.
I am on slide 6, Nancy.
Oh yeah, you can see your slides.
Can you see it?
Yes.
You can see it?
Yeah.
Is the slide there?
Yes.
Okay, can I make a bit bigger?
Yeah, you can maximize it.
You're okay with that?
Perfect.
You okay?
Yes, it's okay.
It's okay. So I know she had done a good job. I am Nancy, for the people who are listening. I'm a counseling psychologist. I work with an organization with the Kenyatta National Hospital as an in charge of the youth-friendly services. And also in the government, I've really assisted in making documents in relationship to young people, or also on relation to sex and gender-based violence. I want to go through all the slides because even though Tina didn't share them, I'm very sure that she went through all of them. She did the introduction of it. Stigma is when someone views you in a negative way. Stigma is a powerful social process of devaluing people or groups. And here in our case, we are talking about the mental health challenges. And if you look at the name of Wanjiku Ngetha, I am Nancy Ngetha. Think about those names. We call ourselves mentoring for life. I'm mentoring her into this field. So Wanjiku is one of my children, the firstborn. And I know she wanted to say something, but she feared how I might react. We happen to have a mentally challenged, mental health issues in our family. Of course, part of our family, the larger family. And whenever I go to the village, and maybe there's a burial, there's a wedding, he never misses there. Now, you find that he will deliberately walk from wherever he was to come and sit next to me. Or if he sees the car at home. So we have purpose as a family. Whenever we are going to the village, we must carry something for him. And one of the two things he looks for is a sonda and a cake. So we need to value people no matter what they are going through. If we don't usually stigmatize diabetes, high blood pressure, why mental health? Discrimination follows stigma and is the unfair and just treatment of an individual. Do we really treat the mentally healthy challenged people fairly? Just think about it. But of course, there is hope. Some of the harmful effect of stigma, I believe she had talked about it, reluctant to seek help. Even walking into Madare Hospital, whenever we have ever referred a child to go to Madare Hospital for admission over 16, the parents are like, how? And they end up even going for loans to have the child admitted in a private place, because how will I tell people that I'm going to Madare Hospital? Others don't like even mentioning the name of the doctors who is seeing their child, or even the relative, or where you are taking your mother, because you mentioned the names like Dr. David Bukusi, Dr. Pius Kegamua, Dr. Margaret Makanyengo. You mentioned those names, and they are well known psychiatrists in this country among the many. People don't want to mention. So how can we fight this stigma? A big part of turning back the stigma of mental health is awareness, both big and small. At the last time when I was in the meeting, we did say that we need to create awareness, and somebody asked how, and I said we take advantage. Teachable moments, teachable months. The month of May is a month dedicated internationally, and of course now Kenya is part of that international. The month of May is the mental health awareness month. Then we can hang again on September 10th, or that month of September, and we usually have the Suicide Prevention Day. Then on 10th of October, some of you think it's a Moi Day. Yes, it's Moi Day, fine, but it's also Mental Health Day. We take advantage, create awareness. And I want to give an opportunity, because I can see you guys, you are interested with mental health. In your church, if you are given an opportunity to say hi, kutoa ushuhuda, make a point of mentioning about mental health. Another thing is, when we have created awareness, we are creating awareness, we need to talk about it. One of the big things people can do is to talk about it, sharing that mental health is common, that it is treatable, and that help is available with help to reduce the stigma. People need to know that there is hope and help, because it ties into the past, why people didn't talk about it. There weren't good options like they are today. Nobody, as I grew up in the career, I didn't know there was mental health day. I didn't know there was a world suicide prevention day. So these things are coming up and we are being told. So we take advantage and talk about mental health. How we talk about mental health also hugely is important. Use the phrase mental health as opposed to mental illness. Mental illness is, although we know somebody could be unwell, it is mostly stigmatizing. It's important to make sure people with this condition don't equate themselves with their illness. Instead of saying, I am bipolar or I am schizophrenic, one may say, I have a medical condition, or I have schizophrenia. Also, it's good when if we are going to stop the stigma, we need to see it in a bigger picture. That is, learning the full cycle of how mental illness issues can affect a person, and understanding that those issues are manageable. People don't want to associate themselves with the behaviors exhibited by people who have mental health challenges. There is a hierarchy of what conditions and the symptoms people are willing to accept when it comes to their own mental health. It's a chronic cycling condition and it's manageable, but too often people may see the negative side of these conditions. It is important to understand the full cycle, the times of recovery, and the clarity. Again, we need to show support to these people who are having mental health challenges. Because of these regarding stigmas too, it can be difficult to those who are dealing with the negative parts of this condition to accept that they need help. So you have to insist on helping them, taking them to hospital, helping them, assisting them to take their medication. Family and friends can offer support to them. Talking to them is important. Telling them you notice a change in their routine and behavior is important. Enlightening them is important, because when people are symptomatic, their insight and their awareness can be impaired. That is, there are times you have mental health conditions, somebody is not even aware what is happening. We call it lack of insight. Helping them understand that there are resources to help and it's okay to talk about is key. Also, we need to have a lot of patience. Tina and I one time had to take one patient to hospital, a relative of a relative. You know, sometimes you don't want to identify with the people who have these issues, a relative of a relative. And I'm telling you, it was a journey from 9 a.m. until 4 p.m. And nobody can notice this lady is not okay. But as we knew there was change of behavior, according to how the relative described, and the lady was very smart. And I'm telling you, it required patience. If it was somebody who can give up, we would have given up. You have to have a lot of tolerance for mental health. Sometimes patients or family members just don't have that tolerance or compassion. There are a lot of difficulties with some of these conditions that you need to be able to see through to get to the core of the treatment. Now, if you're having a problem yourself, you have the mental health challenge, we can look at a few things that you can do for yourself. And this helps in coping with the stigma. When people stigmatize you, number one, get treatment. It is your life, it is your body, it is your mind. So get treatment. Don't let stigma create self-doubt and shame. Speak to yourself, and that's why you need psychotherapy, so that when you discuss with your counselor or your psychotherapist, you are able to discuss and to shun away the self-doubt and the shame. Number three, as an individual, and remember you can also teach this to people that are having the mental challenge and health challenge. Don't isolate yourself. If you have a mental illness, you may be reluctant to tell anyone about it. Your family, friends, clergy, or members of your community can offer you support if they know about your mental health. So if you know you have mental health issues, that means you don't lack insight. You are aware you are bipolar. You are aware you usually suffer schizophrenia. You are aware you usually suffer depression. Don't isolate yourself. Talk with others. Don't equate yourself with illness. I had mentioned earlier, you are not an illness. So instead of saying I'm bipolar, say I have bipolar disorder. Instead of saying, calling yourself schizophrenic, say I have schizophrenia. Join a support group, and this is what we are working on as Mentoring for Life. We want to start maybe as soon as we can, a support group for mental health survivors or people who are still on medication. We are going to start a group. Even if we start with the 2 people, we are going to start a group. And Tina may be able to make that announcement, but I know she's moving. In the next 5 minutes, I should be finishing. We are moving to another meeting for 5 p.m. Get help from school if you're in college, if you're in school, and you can also teach others who are in school and they're having a problem. If you or your child has a mental illness that affects learning, find out what plans and programs might help. Speak out against this stigma. Speak about how people stigmatize mental health, people with mental health challenges. Consider expressing your opinions. It can help instill courage in others facing similar challenges and educate the public about mental health. Other judgments almost always stem from lack of understanding rather than information based on facts. Please note, learning to accept your condition and recognize what you need to do to treat it, seek help, and helping educate others can make a difference. With that, I come to the end of that presentation. Sorry, I was too fast, but also I was taking care that I don't keep you for long, and you had started already by 4. Any questions for me?
I think I have one.
Yeah.
So I wanted to ask your opinion. In the society we live in, let's say the boy child is supposed to be, it's said that they are not emotional beings. We are not emotional beings as opposed to the female gender. We are not emotional beings. So you tend to see men are kind of stigmatized when they express their emotions. Like if you see a man crying, he's seen as weak. If you see a guy saying he's depressed, you're told, oh, you're a weakling, unajifanya, you're seeking attention, such things. So my question is, how would you advise such people?
I think I would advise people to be, whether men or women, I would advise that somebody get in touch with themselves, what we would call emotional intelligence. Believe in what you're feeling so that it can be addressed. However, we know scientifically there is a bit of a difference in the way the female brain and the male brain functions. Not that others are superior than the others, but women are more emotional than the men. But that does not mean that men don't have feelings. So what is important is to have a self-awareness of your emotions, or self-awareness or emotional wellness. And I think this would answer better if we would have a day, and I can be told in advance, a few days in advance, we have a day and we talk about the male and the female brain, so that we understand why women are the way they are and the men, they behave the way they behave. But we are different. That does not mean that men don't feel it. Did you know that in the population, both male and female talk about they are going to commit suicide, and by the end of the day, there are more men who commit suicide as opposed to women. Probably it's because as we talk more, and men keep it to themselves. So I think, Kevin, you can arrange one of the Saturdays, and I can be told that early enough so that I don't get, although today was an emergency, but we can talk about the male and the female brain. We can also talk specifically about emotional wellness, so that we get in touch with our feelings and address them. Thank you. Another one?
Yes, one last question is, okay, according to the report which task force, the mental health task force was given, oh no, according to who? I read an article, according to who? There was, they categorized mental health into two categories, the intellectual disability and the psychosocial. So we focus more on the psychosocial. Then I tend to see, okay, according to the awareness, even me, I'm creating, I'm focusing on the psychosocial, the schizophrenia, the anxiety disorders, the substance abuse disorders. When you look at intellectual disabilities such as attention, ADHD, autism, something like cerebral palsy, you find these diseases are usually kind of ignored. People don't know about them. And in the society, these kids tend to be stigmatized in one way or another.
And quite a lot, and even the families are stigmatized.
So how would you handle such a situation?
I think once again, because when we are defining the mental health, we talk about the neurological disorders. Once again, we go back to the creating awareness, because why they do not come to hospital and why we don't see much of them is because of the stigma. And ask me, I've been at the youth center for over 10 years, and I can tell you these children may be autism, cerebral palsy. By the time sometimes they are coming, they have really suffered, although they don't know they are suffering, but the parents psychologically have really suffered, because even look at a family setup. When you get a child who has autism, sorry to say this, I know we have guys here, it tends to be told it is the mother. So it is put to the mother and the child. So you can see it really starts even from home. If you are married, the in-laws tend to think it's me who came here with this problem. So people shy off even going to the hospital because of the diagnosis. But my experience says those who have ended up in the hospital and have been managed by the psychiatrist, plus the pediatrician if they are young, plus the medical social worker and the therapy, they have done well. In fact, there's one young man, though I've left KNH, he has done so well and he has even gone to college. He has learned a skill, and he is able to learn his life. Yes, you can see there's a gap here, but the minute the parents understand and we support them in terms of psychotherapy, and we try as much as possible as professionals to bring the other partner on board, and if necessary, family therapy, they have done well. So what is lacking is a more and more awareness in the community, which I think, once again, as I said, we needed to, we look for the teachable moments. I hope I've responded.
Yes. And talking about the teachable moment, I think the report written, I think the task force proposed a week.
Sorry?
I think the week of 10th should be a mental health awareness week in Kenya. So I think maybe if it will be implemented, it will serve as a basis for creating awareness about such issues. I had another question. Okay,
Let me read another one.
I think you've handled stigma. You've handled, yes. So what about personal? Okay, Wanjiku started by saying there's something like self-stigmatization, like you stigmatize yourself. You tend to stigmatize ourselves. So I was wondering, how would you advise someone to ensure that they are taking care of their personal mental health?
Is I think about coping with the with the stigmatization is what I have mentioned on my presentation, though I did it very fast. But if somebody has insight about her condition, we handle it during psychotherapy to help somebody accept the situation the way it is. And our challenge, as I said last time, is even when we are doing psychotherapy, when people have improved completely, they tend not to take medication. So they come with a relapse another time. And so the stigma goes on in the village, or even with herself, even when she feels very low, it's like, I'm good for nothing. I'm always like this. I'll never get better. Is the rest of my life going to be like this? But with the proper management, medication, psychotherapy, plus reassurance, and if possible, this support group we are talking about, then someone will be able to deal with the issue of the self-stigmatization. Because like now, if you meet with others who have been battling bipolar, and you see they are doing well. We have very senior people who are battling with bipolar, but they are able to go on with their life because they are given the mood stabilizers. They are going through their psychotherapy. They are seeing their doctors as they expected. And it comes from accepting that here, just the way you would accept you have diabetes, it comes from accepting this is who I am, this is what I'm suffering from, and I need to be doing 1, 2, 3, 4. It doesn't matter what other people think. Remember, you have no control over what others are thinking about you. And that way, we shall be able to fight it, the self-stigmatization. I can see somebody who wrote, although wrote on a private area, private chat. I have a friend who has episode of being totally down in mood, and she isolates herself from everyone. At times, you might not know that she is not well, only to find out that she is drowning in tears. How do we help her? And she really wants to open up about what she is going through. I think it's good if you are a very close friend, get an opportunity, not with other people, talk to her what you are noticing, and ask her, can we get somebody who can help you through about this? And we see where we can interject and do something. The suggested week of 10th October that mark World Mental Health Day. Let me tell you, this is very active in the Ministry of Health. I've been there even on the committees. These days, even they decide which county is going to host it. So this one has been going on. It's only that in Kenya, still, we have very few hospitals with the Department of Mental Health. And therefore, because there is no such a department, it may not be noticed. But the hospitals in Kenya that has a mental health department, this one is very much being marked. The other thing is, companies that have been participating, they have taken note about these 3 days I've talked about, 3 times I've talked about. Like the month of May, I can tell you my diary is full because of the organization. Nancy, give us a talk on mental health. Give us a talk on mental health. Even in the churches, they are able to mark these. So people are becoming enlightened about it. So we can hang on there. I think I can see, I'm not seeing another question. Kevin, are we okay?
Yes, you're okay.
Can I give my final remark? I rush to another meeting.
It's fine. I think we can.
What time do you want to finish?
Our meeting is supposed to end around 5:30 to 6. So, but it seems
I can leave you discussing. There's no problem, but I would like to make up my personal remarks. Huh?
It's okay.
And I want to do this outside mental health. People, COVID is real. I know people are talking like wachana na watu. There's nothing like that. Others are taking it for granted. You don't put your mask as it should be. You're not washing your hands. I'm not saying you. I'm looking at the community. Washing hands as we started on, no sanitizing, not keeping distance. I'm saying this because I have very close friends. Those who were in the meeting yesterday, last night, I mentioned, but I didn't say their names. As we are here, the man of the house is fighting. Okay, he is not in hospital, but positive. Today, we managed to do others, members of the family. Some don't have, some have it. And when it knocks down on people, a person you know, that's when you know reality here. Last night, I slept very late. I was having a session of one who was tested in another organization, but she was suspecting herself because of the way she was coughing, the way she was feeding, and she took herself to hospital. Last night, she was crying alone in the house, not in pain, because it is so isolating. You are in the house alone. When visitors come, they leave the flowers at the door, they leave the food at the door, pick it yourself. You cannot have somebody in your house. And this is all because we do not obey instructions. Promise me that once we finish this meeting, you will take it upon yourself to teach people around you, correct people around you, if they don't have their mask. It doesn't matter, they can be rude. I've done that in the matatu. They can be rude to you, but purpose and tell people have their mask on. Wash your hands, sanitize your hands if you don't have the running water, and keep the distance. God bless you so much. Thank you. And I thank God that I'm a part of this team. Allow me to leave. And I think I need to put my number. I was typing my number somewhere. Allow me to type my contact so that any other specific question, I can get it. 0722 40 35 59. And for Wanjiku, because I work with her closely, 0720 70 20 81. When you get in one of us, we shall be able to talk. I pick calls even late at night. I don't have a problem. Thank you. God bless you.
You're welcome. You're welcome. Have a lovely session. Yeah, other session.
I want to go to the teens now. Teens are having a meeting under my program.
All right, it's fine. It's fine. Okay.
Bye-bye.
Bye. So guys, I hope you enjoyed that session. I'll liaise with her to give us to make the slides available so I can share with you. Before we leave, I want to pose a question to you. Based on mental health. If you look in our society today, there's a lot to do. I'm sure it's not a must to get to, you find yourself into, okay, you might not be affected directly. Mental health issues might affect you indirectly. Like you might know someone, you might know a friend, you might know a cousin, you might know an uncle, or maybe yourself. Personally, I've been there. It's not a good place. I would say we have a challenge, and personally, I'm looking for a team. If you feel you're passionate about mental health, you can reach me. You can inbox me here or talk to DV, or I think, yeah, or Amos. I can see Amos. Yeah, you can talk to me. I'll leave my email address and my number, so you can talk to me. I think I want to start a project where we are writing. There was a proposed in the David. Or has wrong.
Yes, yeah.
Yeah. Or tomorrow you are holding a session where you are talking about the mental health task force report, yeah? Has.
Yeah, that's right.
Hello. Okay. I think Ezron has an issue on his side. So tomorrow there's a session on health roundup. You can attend the session. It will be hosted by DB and Ezra. We'll be talking about the mental health task force report. If you need a copy, you can also inbox me. I'll make it available. If you see the policies, the recommendation made there, they're very promising, yes, and we all have a part to play. Health is teamwork. It's all teamwork. Most of us here are pharmacists, I think. So we can define our role as pharmacists in mental health, and that's the project I'm working on. Like, I want to define the role of us pharmacists in mental health. That is, if you feel you're very, very passionate about mental health, we can talk, we can discuss about it. I think I'll let Brian talk a little bit about it. Brian Omura. Then I can conclude the meeting.
Yeah.
Ombura, where have you gone?
I am here, Kevin.
Yes. I want you to tell us briefly give me maybe an idea or what you think pharmacists can do in the field of mental health. Hello? Ombura? Harriet. Oh, Harriet, I've seen your message. I'll add you. We'll talk. I'll communicate and we'll see how we can help each other. So, yes, Harriet, you have something to say? I think we can conclude our meeting for today. Next Saturday, we'll have a meeting at the same time. I think we'll be talking about anxiety disorders, but I'll confirm. And anyone who has wanted to comment about it, who wants to talk or say hi or say thank you, something. Does anyone have something to say before I end the meeting? Anyone?
Thank you very much, Kevin and Reculture, for organizing this session. I think it was very enlightening. Personally, I associated with most of what the psychologist said, and yeah, I hope every one of you has a good evening.
Okay, I think it's safe for me to adjourn the meeting now. So we'll meet next week, same time, around 4 to 6. We'll be discussing about anxiety. I need you people to kind of participate. So next time I'll be asking questions. So go do your research, then we'll meet next week. You can have a nice evening. You can end the meeting now. Goodbye.